Hello, welcome to Pediatric Pulse. Today we are diving into a topic that every healthcare professional, parent, and a caregiver should be familiar with: anaphylaxis. Anaphylaxis is a severe, potentially life-threatening allergic reaction that can occur within minutes of exposure to an allergen. Understanding the signs and symptoms and immediate treatment options is crucial for saving lives. In this video, we'll explore the essential steps to take during an anaphylactic emergency. Stay tuned as we break down the complex topic into easy to understand segments, ensuring you are well equipped to handle such emergencies with confidence and care. Let's get started. Querying anaphylaxis, start by doing your ABCD assessment. Up to this slide, if you have not watched our video on ABCD approach in pediatrics, please visit our channel and watch a video on ABCD approach in pediatrics to broaden your knowledge on ABCD approach, how it's done in pediatrics. Let's go back to anaphylaxis. We start with the airway. So for airway, we start by checking its patency. We also look for signs of airway obstruction such as stridor, hoarseness, swelling of the tongue, and throat. For breathing, you evaluate the patient's breathing by looking for signs of respiratory distress like increased work of breathing, tachypnea, wheezing, cyanosis, and even reduced saturations. For circulation, we start by looking for signs of shock, such as hypotension, tachycardia, weak peripheral pulses, and reduced capillary refill time. For disability, we evaluate the patient's neurological status. For example, altered mental status like confusion and loss of consciousness. Remember to check your blood sugar at disability. E is exposure. For exposure, expose the patient to look for signs of anaphylaxis like urticaria, angioedema, and flushing. Also check for other potential sources of allergen exposure. Signs of anaphylaxis present: call for help by calling the resuscitation team or even an ambulance. As you wait for your resuscitation team to arrive, remove any triggers if possible. For example, by stopping any infusion. Number 2, lie the patient flat with or without legs elevated. This is to prevent rapid fall of blood pressure and to ensure blood flow to vital organs. Ensure that the patient is seated or in a sitting position to make breathing easier. If it's a pregnant woman, ensure that the pregnant woman lies on the left side. This is to prevent compression of the inferior vena cava. Then give intramuscular adrenaline. In this slide, appreciate the sites and how to administer adrenaline IM. For the sites, we give it on the outer middle third thigh of the vastus lataris muscle. Remember, the dosage in adrenaline in anaphylaxis is age-based. If you have not watched our video on how to administer adrenaline in anaphylaxis, please visit our channel and watch the video on how to administer adrenaline in anaphylaxis. Establish the airway. Position the head to ensure that the airway is patent. For newborns and infants, we position the head in neutral position, not too extended or too flexed. For the big child, we position the head in sniffing position. If the child is unconscious, secure the airway by the use of an endotracheal tube. Then give high flow oxygen either with BVM, the bag valve mask, or even the use of non-rebreather mask if the patient is conscious. Then apply monitoring. Apply a pulse oximeter to monitor your saturations. And apply an ECG to monitor your heart rate and rhythm. Then ensure you have a pediatric curve, the BP curve, to monitor your blood pressure. If there is still no response, repeat another dose of IM adrenaline after 5 minutes. Then remember to give your IV fluid bolus. If it's an adult, give at least 500 to 1,000 mils. And if it's a pediatric, give 10 mils per kg. And remember to use crystalloids. Still no improvement in breathing and circulation, despite the 2 doses of IM adrenaline? Confirm that your resuscitation team has been called or they have arrived. Then start by following the refractory anaphylaxis algorithm. This is because your patient might be going into anaphylactic shock or already in anaphylactic shock. Here are life-threatening problems to look for in anaphylaxis. For airway, look for hoarseness of voice and stridor. For breathing, look for increased work of breathing, wheezing, fatigue, cyanosis, and reduced SpO2 of below 94%. For circulation, look for hypotension, signs of shock like reduced capillary refill time and weak peripheral pulses, confusion, and reduced level of consciousness. Thank you so much for watching. See you in the next video.